This is basic newborn care. I'm so glad you've chosen to view this presentation, which will hopefully prepare you to meet and care for your new baby. This course has been developed with the help of our pediatricians. All information presented is in line with the standards set forth by the American Academy of Pediatrics, but the information in this presentation is not intended to replace the advice of your doctor. Both our nursing staff and our pediatricians have identified these topics as the most frequently reported causes of concern and questions for new parents. We will discuss all of these today, and I hope we will answer many of your questions and help you learn to recognize what is normal and what is not normal newborn behavior. Most parents have a picture in their mind of what they think their baby will look like at the time of delivery. But most of the time, baby will look a good bit different than mom and dad expect. The first picture here shows a baby with what we call caput, or cone-shaped head. Most of the time, as baby moves down the birth canal, the bones of his skull need to shift and mold in order to fit through mom's pelvis. This can result in baby having a cone-shaped head, but it's nothing to worry about and completely normal. This will resolve quickly, and your baby will have a nice round head before you know it. Your baby might also be covered in a white, cheesy substance called vernix. Take a look at the second picture. Your baby is surrounded by amniotic fluid while in the womb, and this vernix serves as a waterproof barrier to protect your baby's skin. The vernix will decrease in amount as you get closer to your due date. So a preterm baby would most likely have more vernix than a full-term baby. Many babies have fine, downy hair across their ears, their shoulders, and other various places of their body, as shown in the third picture here. This hair is called lanugo, and it's believed that lanugo helps the vernix stick to baby's skin. Like vernix, lanugo also decreases in amount as you approach your due date. All of these are normal findings in a baby who's fresh out of the womb. Another normal finding in a brand new baby is dry skin that may be peeling. This is most likely seen in babies who are born after or on their due date. Your baby's eyes are usually open immediately after birth. She might be awake for an hour or two, and then she might take a long birthday nap. This is why breastfeeding in the first hour after birth is so important. We really need to take advantage of this wakeful time. Your baby's vision will not be perfect, and he will not be able to see very far, really only about 8 to 15 inches away. Your newborn will probably look at your face and your eyes, especially during feeding. Enjoy this time and talk to your baby. He or she will recognize your voice and be comforted by it. It's normal for your baby's hands or feet to be blue right after delivery. This is called acrocyanosis, and it may happen periodically during the first day or two of life. This is concerning to parents sometimes, and it can look scary, but it is normal in the first 48 hours after birth. If you notice your baby's hands or feet are turning blue, it could mean that they are cold. The first hour after birth is often called the golden hour. It's recommended that your baby spend this hour on mom's chest, skin to skin with her. All full-term healthy babies are placed skin to skin with mother immediately after delivery. Your baby will be quickly dried and a hat will be placed on his or her head. Then mom and baby will be covered with blankets. Babies who are allowed to transition on mom's chest breathe better, maintain their body temperature better, cry less, have a decreased chance of low blood sugar, and they have better success with breastfeeding. There are also benefits of skin to skin for mom. It helps a mother bond with her baby, decreases her bleeding immediately after delivery, jumpstarts her milk supply, and increases her confidence with breastfeeding. Labor is hard work that mom and baby endure together. Your baby has lived inside of you for 9 months, and you're the only person that he or she knows. Allowing your baby to spend at least the first hour of his or her life on your chest Listening to your heartbeat, smelling your scent, and hearing your voice is the most gentle way to help your baby acclimate to life outside the womb. You can scan the QR code here to watch this awesome video on the benefits of skin-to-skin time. One thing you need to know about newborns is that they sleep a lot, 16 to 17 hours per day, or even more. But just because your baby is sleeping a lot does not mean that mama will be able to sleep a lot, unfortunately. Your new baby might only sleep for 1 to 2 hours at a time. Different babies do have different sleep needs, and babies need less sleep as they get older. In the beginning, they often have their days and their nights mixed up. So if you notice that your baby is more active at night while still in the womb, the trend will probably continue for a little while after birth. That cycle will gradually reverse as your baby gets used to more stimulation during the day and less stimulation at night. Another thing to note is that while you shouldn't intentionally try to skip nighttime feedings, babies who are healthy and growing normally don't need to be awakened to feed at night. You don't have to wake your baby up to feed at night if he's gaining weight like he should be. Lots of parents enjoy rocking their babies to sleep, but there are others who want to train their babies to put themselves to sleep. If this is something that you want to teach your baby, it'll be helpful to put him to bed when he's sleepy but not asleep. This will help him learn to get used to going to sleep in his bed and not in mama's arms. Safe sleep for babies is one of the most important topics we can discuss. There really is nothing more heartbreaking than losing a baby to SIDS, and we're always working to reduce the occurrence of sudden infant death syndrome. The American Academy of Pediatrics has these recommendations for safe sleep for infants. Babies should sleep on a flat surface. Babies should sleep on their backs. You should allow your baby to have supervised tummy time when he or she is awake and you're watching them. Your baby should not sleep with soft bedding, blankets, stuffed animals, or pillows in his or her bed. Your baby should not sleep in your bed or in the bed with other people. It's recommended that newborns should sleep in the same room as their parents, but on a different sleep surface. Babies less than 4 months of age should not routinely sleep in sitting devices like car seats, strollers, or swings. This is because of the potential for your baby's airway to become occluded when they are in the sitting position. This doesn't mean that you need to panic if your baby falls asleep in the car, but make sure that you are observing your baby, checking on the baby, and don't allow them to sleep overnight in the sitting devices. Studies have shown that 2 months of breastfeeding significantly reduces the risk of sleep-related deaths. So that's another great reason to breastfeed. Parents should keep themselves and their baby away from nicotine, alcohol, marijuana, and any illicit drugs, really anything that could be harmful to your baby. Don't expose your baby to cigarette smoke. Also, pacifier use is associated with a reduced risk for SIDS. So you may want to consider using a pacifier. It's also not recommended to cover your baby with blankets, but swaddling is sometimes helpful until your baby learns to roll over at around 3 to 4 months of age. Some of you are probably pretty comfortable changing diapers. Maybe this is something you've done a lot in the past. But I'll be willing to bet that we probably have some listening who have never even changed a diaper. And that is okay. You're about to get lots of practice and you'll be a pro before you know it. But for now, scan the QR code here to watch this really good video on diapering your baby. Now we're going to take a few minutes to talk about newborn bowel movements, also known as baby poop. Parents get a little bit uptight sometimes over their baby's poop, so I want to show you what is normal. I want you to know what normal poop looks like so that you can recognize what is not normal. And just to let you know, the next few slides will contain pictures of newborn bowel movements. Okay, this is a picture of a meconium bowel movement. This is what your baby's first poopy diapers will look like. This meconium forms in your baby's intestines before they're born. It's thick and sticky. It looks really gross, but it actually does not have an odor. So that is one good thing about meconium. It can be black or dark green, and usually it's passed during the first 2 to 3 days after birth. Once your baby has passed all of this meconium, then their stools will turn yellow or green. Now we have a picture of a transitional stool. When your baby starts to digest breast milk or formula, usually on about day 2 or 3, you'll start to see this type of stool, this type of bowel movement. It's thinner and looser than the meconium, and it's lighter in color and it's less sticky. Transitional stool can start to have an odor, and it will either be greenish brown or greenish yellow in color. So after all the meconium has cleared your baby's system and your baby is eating well, either breast milk or formula, he or she will probably be having several bowel movements every day. This is what we expect. And if you're breastfeeding, especially, the number of poopy diapers that your baby is having daily is a good indicator of how much milk they're taking in. So it's a good sign if your baby is having several poops every day. The picture on the left shows a bowel movement from a formula-fed baby, and the one on the right shows poop from a breastfed baby. So notice that the breastfed baby's stool is yellow and seedy. This is what it's supposed to look like. Once your baby's about a month old, he or she can start to have fewer bowel movements, sometimes only one every few days, and you should talk to your pediatrician if your baby is acting uncomfortable or if you are concerned about this. Babies can also grunt and kind of struggle and act like they're constipated when they're trying to poop, but as long as the stool is soft, this is normal. You shouldn't be concerned. Worrisome signs of abnormal bowel movements would include hard stools, bloody stools, white stools, or stools with mucus or snot. Mucus looks like snot. Always let the doctor know if you see any of these signs. The next topic I want to talk about is jaundice. I'm sure you've heard of jaundice. It is a very common condition in newborn babies. It causes their skin and the whites of their eyes to take on a yellow color. And it's caused by a buildup of bilirubin in your baby's blood. All babies born at Coffee Regional are screened for jaundice at 24 hours of age. And if treatment is needed, your baby will be given phototherapy. This just means that your baby will be placed under some special blue lights to help their body break down all that extra bilirubin. And though, jaundice can have severe effects in very rare cases, the vast majority of the time it's managed easily by phototherapy and the babies do just fine. Scan this QR code to watch a really informative video on jaundice. Your baby will undergo some medical testing before being discharged from the hospital. This will include a metabolic screen, which will test for any congenital metabolic disorders, a hearing screen to check your baby's hearing, a pulse oximetry screening to check for congenital heart disease, and also a jaundice screen, which we have just discussed. Scan this QR code to watch a video explaining each of these newborn tests. Umbilical cord care is a very important part of newborn care. The umbilical cord is the lifeline between mom and baby during pregnancy. And then after delivery, the cord is clamped and cut so that all that's left behind is a small stump right on your baby's belly button. The stump will turn brown and fall off, usually within 7 to 10 days after birth. But until that happens, you should clean around the site with alcohol and a Q-tip, or you can use those alcohol wipes. But you want to do that with diaper changes a couple of times each day. This will help the cord to dry out and prevent infection. When the stump begins to come loose, don't pull on it. This can hurt the baby. Just let it come free on its own when it's ready. And let your pediatrician know if you see redness or drainage from the site. Those could be signs of infection. But you can go ahead and scan this QR code to watch a video on umbilical cord care. One more thing is you should just do sponge baths. Don't immerse your baby in a tub of water until that stump has dried up and fallen off. Circumcision is the surgical removal of the foreskin that surrounds the head of a baby boy's penis. Soon after delivery, parents are asked to make the choice. Do you want to circumcise your baby or leave the foreskin intact? So it's good to do some research before delivery. The AAP advises parents to learn the facts about circumcision and to weigh the pros and cons before making that decision. Just to give some context, the circumcision rate in the United States is very, very high, but only about 20% of males in the world have a circumcised penis. Circumcision can be performed for religious reasons or for cultural reasons, and it is generally considered safe as long as it's done by an experienced provider. The most common problems following a circumcision are bleeding and infection, and these are rare. This slide just kind of outlines the basic care after a circumcision procedure. So the main idea is to protect the site as it heals. So for the first 24 hours, you're going to apply Vaseline-coated gauze to the baby's penis with every diaper change. At this point, the penis is going to be red and swollen. This is normal. You do want to apply pressure and notify medical staff of any active bleeding from the site. You should not see any blood in the diaper larger than the amount, which would be about the size of a quarter. Anything bigger than that, you would need to come back to the emergency room if you've already gone home, or definitely call nursing staff to your room. After the first 24 hours, you will continue applying the Vaseline gauze, not the gauze, but just the Vaseline to the penis. This is to prevent anything from sticking to that site as it's healing. At this time, the penis will be covered in a crusty discharge for about 7 days. While it's healing, you don't want to use soap or wet wipes on that site, only warm water to clean if the penis gets soiled by urine or a bowel movement. And to prevent the formation of adhesions at the site, you do want to gently retract the foreskin every day, just to make sure that no scar tissue forms and you don't have to have any kind of revision of that circumcision. A really big portion of the questions I get from new parents center around feeding. People want to make sure that they know when and how much to feed their baby, and they get very concerned about this. It would be really simple if babies could just use their words and say, "Mom, I'm hungry." But, fortunately, though they can't talk, babies are still able to communicate hunger cues that are pretty easy to recognize if you know what to look for. The biggest thing I want you to remember is that you don't need to wait until your baby is crying to feed him or her. Crying is a late hunger cue, and there are earlier cues that you can observe for, and you can respond before your baby gets to the point of crying. It can be really difficult to feed a crying baby. Most of the time, especially if you're breastfeeding, you're going to have to calm the baby down before you can successfully feed. So get in the habit of responding when you see your baby just beginning to stir around, opening his mouth, turning his head from side to side. This is the best time to feed. So you can scan the QR code here to watch a video on hunger cues. Okay, so it's important to know how to recognize when your baby's hungry, but it's also good to know how to tell when your baby has had enough to eat. Overfeeding your baby can cause her to spit up more and have tummy aches. So these are the signs that your baby is full. If she's turning away from the nipple instead of toward it, if she stops sucking or slows down her sucking, if she's just not acting interested in feeding, or if she starts crying shortly after you have started feeding, if her body is relaxed, especially her hands, she falls asleep at the breast or while taking the bottle, or starts to just spit the milk out instead of swallowing. Those are all signs that your baby is probably full. Here's a picture here of a baby's hands. Oftentimes at the beginning of a feed, when the baby's hungry, her fists might be clenched tight, but as she drinks the milk and fills her belly, her fingers will start to relax. And this is one of the easiest signs for you to recognize. I really hope all of you are at least considering breastfeeding your babies. These are the general breastfeeding guidelines for the first few weeks. You'll need to feed your baby on demand. That means not on a schedule, on demand when your baby asks to be fed. And they'll need to be fed at least 8 times in each 24-hour period. 8 to 12 feeds in 24 hours is considered normal for the first few weeks. And the reason you have to feed that often, there are a couple of reasons. First of all, on the day of birth, your baby's stomach is about the size of a marble or a grape. It's really tiny. Your breast milk is digested quickly. And also, you're going to need really frequent breast stimulation to elevate your prolactin levels. Prolactin is your milk-making hormone. That's the hormone that tells your body to make milk. We want that level to be high so that you'll start to make lots of milk and have plenty of milk for your baby. Now, you'll need to be prepared also to stimulate your baby in order to get at least 8 feeds in the first few days. After being awake for an hour or two after birth, babies usually get really sleepy after that. And we can't just assume that they will wake up on their own when it's time to eat. So you need to be prepared to wake them up to get those feedings in. When your baby is not sleeping, there's a good chance he's going to want to cluster feed. And this means that he may feed and then come off the breast and then want to go right back on after 30 minutes to an hour. And he may repeat that cycle for a few hours. And then he's probably going to sleep for a few hours. This is all normal, and the feeds don't have to be evenly spaced as long as the total number of feeds is at least 8 to 12 in 24 hours. I know I keep saying that, but I really want it to sink in. In the beginning, one of the ways that you're going to monitor your baby to make sure he's getting enough milk is to count the wet and dirty diapers. By about the 4th day of life, your baby should ideally have several of each every day. These are the guidelines for formula feeding for newborns. You should know that formula-fed babies should be fed 1 to 2 ounces, which is 30 to 60 milliliters of formula, about every 3 to 4 hours in the first days. So while you're in the hospital, they're probably going to tell you to feed about 30 milliliters per feed. Some babies will take a little less than that, and some will take a little more. Your baby does have a really tiny tummy, like we've already talked about. Overfeeding can cause, a tummy ache, gas, and spit up. In the first few weeks, if your baby is consistently trying to sleep longer than 4 to 5 hours, and if they start missing feedings during those times, probably need to wake them up and offer a bottle, at least until your baby's back up to birth weight and the pediatrician tells you, there are no concerns about weight gain. It's best to feed on demand and use the every 3 to 4 hours just as a guide in the beginning. If your baby is showing hunger cues and you know that he's hungry and it's only been, 2 hours or 2.5 hours since the last feed, of course you would still want to feed. By the end of the first month, your baby will probably be drinking at least 3 to 4 ounces of formula every 3 to 4 hours. And then by 6 months of age, your baby will probably be drinking 6 to 8 ounces of formula about 4 to 5 times per day. Whether you are breastfeeding or bottle feeding, it's important to burp your baby. There are different ways you can hold your baby for burping. You just want to make sure that her back is straight. You'll use firm pressure as you pat her back, but remember to also be very gentle. And don't forget a burp cloth or a bib, because babies often have wet burps. This is, it's not unusual for them to spit up a little bit of milk as they burp, and you just want to be prepared for that. Scan the QR code to watch a good demonstration of proper burping technique. Sometimes parents can get a little antsy, a little excited to start baby foods and cereal, but it's recommended that your baby receive only breast milk or iron fortified formula for the first 6 months of life, okay? Your baby does not need water, cereal, baby food, or anything other than milk during that time. Starting at around 6 months, when your baby starts to be able to sit up, when he or she's developing more trunk control, you may begin to introduce solids. However, it's still really important that you continue to allow milk, breast milk or formula, to be the primary source of nutrition for the baby until his or her first birthday. So when you start solids, you have to continue feeding milk. It can be a little bit scary sometimes to think about bathing your newborn, especially when it's your first baby. But we'll talk through it. We're going to talk about all the ways to make it as easy as possible. First thing I want you to know is that you're going to want to wait until after the umbilical stump has fallen off to give your baby a tub bath. You'll just do a little sponge bath until that time. After the stump has fallen off, you can use a baby bathtub or a sink, whatever you're more comfortable with. Remember to only use baby soap. Don't use adult soap. And you might want to just use water on your baby's face. Always test the water to make sure it's not too hot or cool. You can use a bathtub thermometer if that makes you more comfortable. You're going to need to plan to bathe your baby's face, neck, and diaper area daily and as needed. But you really only have to wash your baby's hair and give a full bath every 2 to 3 days. Newborns don't get that dirty. So you only have to do it every 2 to 3 days, especially if your baby doesn't enjoy bath time. But if your baby loves a bath, then by all means, do it every day. Just be careful not to over dry their skin by using too much soap. It's going to be extremely helpful if you have everything laid out before you start the bath. And if you can have an extra set of hands, especially in the beginning, that will be even better. Try to make sure the room temperature isn't too cold. Babies do not like to be cold, and lots of times this is why they cry during bath time. If you can use a plastic cup to gently pour warm water on the baby during the bath, this tends to help keep them calm and warm. And also, if you can use baby soap from a pump bottle, it only takes one hand for that, and it's a game changer. You can have one hand on your baby and one hand pumping the soap. You're going to want to remember to bathe between all the little creases. If your baby has chunky thighs or neck rolls, make sure you get all of those nice and clean. And then when you're finished, wrap the baby up quickly so they don't get cold. If you find that bath time is relaxing to your baby, you can incorporate it into your bedtime routine. But if the bath seems to stimulate your baby and kind of make them more awake, you'll probably want to do it earlier in the day. Click this QR code for a demonstration of bathing a newborn. Let's talk a little bit about crying. We all know that babies will cry from time to time, but what does it mean and how should we respond? There are baby books out there, I know guys, that recommend, you need to let your baby cry it out in certain situations, but it's important to know that this principle does not apply to newborns, okay? You should always respond to your newborn when he or she cries, because crying is your baby's way of communicating with you. They can't talk, so they cry. And it's also a way for your baby to release tension when they're feeling overwhelmed. And sometimes babies do get overwhelmed by sights or sounds or sensations. You want to respond quickly to your baby when he or she cries, because that's going to help your baby learn to feel safe and secure and to trust you to take care of them. Always do your best to meet your baby's needs. You're not going to be perfect, but do the best that you can, because they are truly the most vulnerable little humans and they rely on you for everything in the beginning. Sometimes it can be challenging to identify why your baby is crying, but here are some questions that you can ask. Excuse me. The first question is my baby hungry? Is it time for a baby to eat, or does baby just want to suck? Do you need to let the baby suck on the breast or suck on a passy? Do I need to change the diaper? Some babies will fuss and cry when they need to, when they're about to soil their diaper, and some babies will cry when their diaper is dirty. So it's always a good idea, check that diaper when your baby's fussing. Or does my baby just want to be held? Babies, live inside their mamas for 9 months, and oftentimes after they're born, they still want to be close to their mama. So pick your baby up, hold your baby, try gently patting your baby on the back. You can rock the baby or walk around. Make a shushing sound, shh in your baby's ear. Sometimes that can be calming to your baby. And then also, is my baby hot or cold? Babies oftentimes, or most of the time, they need like one extra layer of clothing than adults do. So just judge the temperature in the room and say, is it possible that my baby's hot or cold? And then lastly, is my baby lonely? You can give your baby a change of scenery. Maybe you want to go outside. That can be distracting. Lots of babies like to be outside. Give them a little massage, rub their back, lay them down on a blanket and rub their legs. Just try to be really soothing, and oftentimes that can be helpful. Scan this QR code for a video on baby behavior and crying. Now we'll talk a little bit about fever and illness in the newborn. As far as temperature assessment goes, the AAP recommends that for babies aged newborn to 3 months, they should have rectal temperatures taken. That's the most accurate way to assess temperature in a baby newborn to 3 months of age. So the way that you're going to do that is always clean the end of the thermometer with rubbing alcohol or soap and water, rinse it with water and dry, and then you can use a small amount of lubricant like Vaseline or KY jelly, some kind of lubricant on the end, just a little bit. You can either lay your child on his or her tummy across your lap or on a blanket, or you can lay them on their back. Gently, hold their legs in place. Try to keep them calm. You're going to turn the thermometer on and insert it just a little bit into the anal opening, not too far, only a 1/2 inch to 1 inch, and that's going to be far enough. Hold the thermometer in place and try to keep your baby still gently while you're checking the temperature. And then after you hear the beep, you can remove the thermometer and check the reading. You always want to re-clean these thermometers and make sure that it's labeled so that it will always be used for rectal temperatures. You wouldn't want to use it in the mouth after you've used it for a rectal temp. Once your baby is 3 months old, you have a few other options for checking temperature. You don't have to always do rectal temps after 3 months. You can also use, you can do an axillary temp, which is under the arm, or a tympanic temperature in the ear. It's recommended that you use digital thermometers. Don't use those old style mercury thermometers. If you have any of those, get rid of them. They can be toxic if they break, so we always want to use the safe digital thermometers. So what is a fever and what does it mean? Okay, normal body temperature for a newborn is 97.5 to 100.3 degrees Fahrenheit. So anything higher than 100.3 is going to be classified as a fever. Fever is a sign of illness, but it's usually a good sign that your baby's body is responding and fighting the infection. About 14 out of every 1,000 healthy babies born full term will have a fever between 8 and 60 days of age. So it's not extremely common, but it's not unheard of either. Most of the time, a fever in a newborn doesn't indicate a severe illness, but it can be challenging, to quickly identify the reason for the fever while avoiding unnecessary tests or hospitalizations. Nobody wants to subject a newborn baby to having to be admitted to the hospital or having painful testing done. More than 10% of infants with a fever are diagnosed with a urinary tract infection. Other causes of common infections for newborns would be ear infections, the common cold, croup, flu, RSV, pneumonia, gastroenteritis, and then occasionally sepsis or meningitis. But the likelihood of an invasive bacterial infection, such as meningitis or sepsis, is really low. It's fewer than 0.5 of infants who have a fever will be diagnosed with one of these serious illnesses. So what should you do if your baby has a fever? So we've already said 97 to 100.3 degrees Fahrenheit is the normal body temperature for a baby. So if your baby has a temp higher than 100.3, that's going to be a fever. First of all, if you think your baby has a fever, if you think your baby feels warm or hot, you need to check their temperature with a thermometer. You can't just rely on how your baby feels to you. If your baby's temp is higher than 100.4, taken rectally, then you'll want to notify your pediatrician. If your baby is younger than 3 months old, your pediatrician should be notified immediately, even if there aren't any other symptoms. Sometimes the only symptom you can identify is a fever, and you need to let the doctor know. This can mean that, sometimes on the weekend or after hours, you may have to have an ER visit or a clinic visit if you can't get in to see your pediatrician quickly. So once again, it's much better to try to avoid these infections than have to deal with them when they occur. Okay, just a little bit about teething. Teething happens when the first set of teeth breaks through the gums. These first teeth, we often call them baby teeth. And the first tooth can appear anytime between 3 and 12 months. But most babies are going to get their first tooth between 6 and 10 months. By the time your baby or your child is 3 years old, they will probably have all of their baby teeth. Teething is a normal part of baby's development, but it can have some aggravating symptoms for your baby. According to the AAP, some of the symptoms you may see when your baby's teething include mild irritability, a low-grade fever, drooling, an urge to chew something hard, and then visible swelling of the gums. Parents do not like to see their babies uncomfortable, and they always want to know, how can I help my baby to feel better? How can we manage the discomfort of teething? So due to the serious risk of harm, the FDA warns against the use of teething necklaces worn by either the infant or the parent. I believe this is due to a choking hazard. They also warn against teething tablets and any topical medications for teething pain. I believe there is some ingredient in those medications that has harmed babies in the past, although I think it's been rare situations. There are documented cases where these meds have hurt a baby. So the FDA just warns against it now. They say you shouldn't use any of those things. The recommendation by the AAP to manage the discomfort of teething is to just gently rub your baby's gums with your finger or give them a firm rubber teething ring to chew on. Some parents like to wet a washcloth, stick it in the freezer, and then let the baby chew on that frozen washcloth. Sometimes that feels good to baby's gums. If you have tried these interventions and your baby is still just really uncomfortable, notify your pediatrician. Just let them know, this is what's going on. This is what I've tried. The baby's not really getting any relief, and they may be able to give you recommendations for other things that you could do. I hope that this has been helpful and that you feel more prepared to welcome and care for your new baby. I know we've covered a lot of information, and there is so much more that we could have covered if we had time. So if you have more questions, I would love for you to reach out to me. I always enjoy meeting and working with expectant parents and new parents. My email address is donna.vickers@coffeeregional.org. If you can send me an email, we can set up a time to either meet in person or talk over the phone. I'm happy to answer any questions that you have. Also, your local pediatrician is going to be a great source for more information and questions. You can also go to healthychildren.org or aap.org for more information on the topics we've covered today, as well as additional topics. So please let me know if I can help any of you further. Congratulations on your growing family, and I hope to talk with you soon.